I'm Kieran. I'm also one of the second year medical students, and I've taken this research project in collaboration with SCCT to look at the effect of social media on the public perceptions of and response to the COVID-19 pandemic. So since the first cases of coronavirus were reported in 2019, the pandemic's faced an unprecedented amount of social media coverage. And the coverage has been extensive and has allowed for information to be disseminated across the medical community as well as the general population. And as misinformation as this has led to misinformation circulating widely, it subsequently made the World Health Organization term this as an infodemic. So what exactly is an infodemic? So it's been described by the World Health Organization as being too much information, including false or misleading information, in digital and physical environments during a disease outbreak. And the impact of misinformation being more widely received than factual information is potentially dangerous, as vulnerable people or maybe those that have low levels of health literacy may be more susceptible to following this guidance, which could impact their health. However, despite this, those who may have believed misinformation may not necessarily fit into these categories and may have just been carried away by social media influencers or maybe friends who share those beliefs. So it's important to recognise why misinformation can have such a harmful effect on attempts to maintain public health. So as I've described before, when misinformation is circulated online, it does have the potential to reach a wide audience. And this was particularly highlighted during the COVID-19 pandemic, when people were urged by doctors and the authorities to receive vaccinations against the virus, yet some people were dissuaded by rumours that they came across on social media. So it could mean that those who are more vulnerable to the influences of social media in communities may not be receiving the correct guidance, and therefore the misinformation online may partly or wholly negate any positive gains that were being made to minimize the effect of COVID-19. And the effect of social media has particularly been highlighted during the pandemic, as it allowed a platform for celebrities and influencers to share their thoughts on disease. And many of these people didn't come from a credible or medical related background. So it has allowed for misinformation to be shared and has potentially circulated harmful ideas. And in order to tackle this infodemic of misinformation, the World Health Organization developed a Mythbusters page to address the misinformation, and it informed people on how to also report anything that they came across. And this was effective in bringing insight into misinformation topics that had been circulating widely. For example, one of the information pieces I came across was wearing face masks could cause oxygen deficiency, which made people less likely to wear face masks. And determinants of health. So what are determinants of health? So it's like a range of factors that influence mental and physical health of individuals and populations, and they're made up of social, economic and environmental factors, and some of them are listed here as an example. So research methods. So the methodology of my research consisted of qualitative research as well as literature reviews. And prior to starting my research and interviewing some people about the effects of social media, I had to apply for ethics approval through the university system. And then once that was granted, I was able to select participants by a combination of purposive sampling and snowball sampling from my local community. So purposive sampling was used as I was able to select potential participants that were from a diverse age range, as well as a variety of different ethnic backgrounds. And if some participants chose not to take part, for example, reasons being that they may not be active on social media, then snowball sampling was used to identify some people that gave consent to being part of the research. And altogether, I received responses from 9 people, and they aged between the ranges of 19 to 38. So some of the results, ensuring that the public has a sufficient level of health literacy is integral to maintaining public health. So this ensures that people are able to access medical information online and can make informed choices about their health, which can lead to fewer hospital visits. However, disparities in healthcare do mean that those who may come from low socioeconomic backgrounds or may not have proficient English skills may be affected by this more, which could possibly affect the way that they view health-related information online. And when participants were asked if medical terms online were easy to understand, some participants answered that it was hard to understand and occasionally got confusing. And another participant stated that I'm not very good at maths, so sometimes it got a bit hard to understand. So this suggests that maybe the way that information is published online is not easily understood by everyone. And another participant did say that the use of statistics did help show what was being reported, but sometimes it got difficult to understand. And whilst I was undertaking my literature review aspect of my research, I found that a study showed in the UK, 4 in 10 adults struggle to comprehend health-related information published for the public, and more than 6 in 10 adults struggle to understand information when it involves the use of numbers and statistics. So now moving on to social media and misinformation. When asked about misinformation about COVID-19 on the media, all participants discussed at least one aspect they came across. Many participants discussed the vaccine in particular, and common themes arose from the survey, such as the vaccine containing a microchip and that the vaccine could cause blood clots and infertility. And the spread of misinformation has allowed for inaccurate messages to be shared, which could prevent the practice of safe medicine and create further barriers between healthcare professionals, the media, and the population if they believe that medical staff are in on a conspiracy to chip them or render them infertile. And when asking the BAME participants of the survey if they had come across any conflicting information in their community compared to what was being reported in Western media, one participant stated that they had read that herbal remedies could be used to stop COVID infection. And reports of alternative medical treatments has also been described in the literature, as one article I came across whilst doing my research described a series of overdoses of chloroquine in Nigeria after it was reported in the media that chloroquine was effective in treating COVID. And another participant shared that I can't understand English fluently, but for family members that didn't understand English, it was hard for them to understand what was being told by the government. So this could highlight that some communities may have felt more isolated in the pandemic and weren't able to access information that was intended to be shared across the population. And it could mean that maybe those that don't understand English as well may have had to rely on social media and other sources to make decisions about their health. And now attitudes towards vaccination. So one participant described seeing a mix of attitudes online. So a positive view was that healthcare professionals were explaining the importance of the vaccine and urging people to have them. Whereas a negative attitude was that a participant saw Facebook posts on how dangerous the vaccine is and also saw a lot of conspiracy theories on that platform. And the same views were echoed by another participant who described a lot of negative views towards vaccination, with people planning to protest against giving vaccines to people as they were said to be untested. However, another participant stated that the coverage of vaccines had been vast, which helped persuade them to become vaccinated. So it does suggest that although all of the participants described seeing negative views online, it didn't deter them from being vaccinated and instead helped some people become vaccinated instead. However, another participant did suggest that more could have been done to appeal to a younger generation about the importance of vaccines, which suggests that perhaps healthcare professionals could use the pandemic as an opportunity to begin sharing information in a way that is more accessible and possibly impactful to a younger generation. So attitudes towards the COVID-19 pandemic have been greatly influenced by people's thoughts and actions posted on social media. And the literature has shown how health-related information can be rapidly disseminated across different platforms and highlights both in the positive and negative effects it can have on the public. And clickbait-worthy titles have been used to draw in a younger audience, which could possibly have negative consequences. And is medical expertise a guarantee of impartiality? So despite the belief that misinformation can be shared by those who may not come from a medical related background, some information can also be shared by physicians who have undisclosed financial conflicts of interest. So whilst I was undertaking my research, I found a study that stated that almost 27% of medical educational bloggers have had financial conflicts of interest, and none of these bloggers had declared this in their publication. So it does suggest that even if the information given proves to be accurate, it must call into doubt their impartiality and potentially undermine their views. So sadly, this can only negatively impact on healthcare experts free from vested interests. And in conclusion, social media is now used at an unprecedented level to share information globally, and the pandemic has allowed for lessons to be learned and possibly allow for changes to be implemented that allows for accurate information to be shared in a secure and accessible way for all. Thank you for listening, and a massive thank you as well to the SCC team that's helped me with my research.
So, Emma, that's yeah, really good rattle through of that massive subject, really, isn't it? Any questions for Emma? Carrie?
Sorry, me again.
It's good.
Hello, Kieran. No, really, really interesting, because that's what we were dealing with in Burngreave. I mean, we had a Let's Talk COVID stall quite regularly outside a community centre, and we were hearing loads of the stories that you told, the misconceptions that you've told. And a lot of the confusion was also because government was behaving so abominably and not following their own rules and all that, which just, yeah, added to it. But I mean, I think one of your conclusions is really, really significant, and that is the one about some medics having vested interests. And I think that is absolutely key to kind of elaborate on that, because I mean, we're in danger, aren't we, with a lot of contracts within the NHS going to private companies. So the whole thing about private companies obviously have a vested interest. So I think that's really, really interesting, and a point that could be elaborated on. So yeah, no, it's really good that you picked up on that. Thanks very much.
Thank you.
Judy, I can just see your finger, but I can't see any other bit of you. But so presumably you want to ask a question. Thank you. That's better.
Thank you, Kieran. That was very interesting. And one thing, you know, especially listening to Carrie, to what extent did you feel that people were actually, their information was coming to them, they were receiving it rather than searching it out themselves? And a sort of secondary thing to that is, me, you know, when we were trying to search out information for ourselves, where did we go? As Carrie said, the government was very confusing, but even when it got to get its act together regarding information, it's it's not very user-friendly information, which is surprising, really, because you think they'd have the departments to sort of look at that. But anyway, so yeah, did you get a sense that people were that they were receiving it, or were they actually it out?
I think it's kind of a mix of both, depending on where people were accessing this information. So for example, on different platforms such as like Facebook and Twitter, when things have gone like viral and they've been trending, I think people have been receiving that rather than searching it out. And algorithms on those different types of platforms do mean that if someone interacts with something, so for example, if it was against the use of vaccines, if someone interacts with that, then a lot of posts that they then receive have links to similar topics like that. So that's possibly how people have not fallen into these traps, but received a lot of misinformation by interacting with something that someone else has shared, which kind of floods those people with a lot of misinformation online. And I think as well, when people have gone to seek information, maybe some people have struggled to find credible resources online. So the NHS was really successful in producing like top leaflets and publications where you were were able to find out more about symptoms of COVID, which were useful. So I think it's just a mix of both, depending on where people chose to find this information. Yeah.
Judy.
Thank you. Yeah, just as to add to this, how because the various fact-checking, what are they called? Platforms, I don't know. Sources of fact-checking were evolving. Did people know about these? Were they?
Well, on some social media platforms now, there's direct links to the World Health Organization website. So I feel when people come across information and it has those links, if they see something that they don't think is quite right, then they're more able to challenge any information they see and make informed decisions themselves about what they choose to do about their health, which I think has been quite useful in helping people be more wary of things that they might see online.
Thank you.
Okay. Thank you so much, Kieran.